Good night, everyone. Welcome back to one of our webinars. First, I would like to thank Brightbot.com for sponsoring these webinars. I would like to remind you that your microphones are going to be muted throughout the presentation, but we're going to give some time at the end of the presentation to for you to ask some questions, which is our favorite part. Also, if you have any questions that maybe we are not able to answer because of time, or you're not watching this live, then you can go into brightbot.com and record a video question, and me or Dr. Martinez or someone else will answer that question for you. Again, these webinars come from our medical experience, but they do not replace a medical consultation. So let's begin. Okay, so tonight we're going to be talking about liver diseases. My name is Jaime Mesa. For those of you who are new, I'm a medical doctor, and today will be joining me, helping me with the presentation, Dr. Luz Martinez. We're both medical doctors that work with chronic conditions, among some other conditions. So I hope you enjoy it.
Okay, let's start. Hello, everyone. We're gonna start talking about the anatomy and the function of the liver. The liver is one of the most important organs in our body. It is located on the upper right side of our abdomen. Normally, you can't feel your liver because it is protected by the rib cage. It weighs about 3 pounds. And an amazing fact it is that it is the heaviest internal organ in the body and the largest gland in our human body. It is composed by 8 segments that will be a little bit important later in the presentation. And among of the functions, the main functions of the liver are the first one, turn food into energy. Also it clean and detoxify the body, it metabolize and eliminate some drugs, it eliminates the alcohol and some toxins from the system. It also produces bile that is a yellow and yellow-brown liquid that is composed by bile salts. It also has an amazing function, but it can regenerate itself. It is the only visceral organ that can do this function. And the last important function of the liver, it stores nutrients for fasting period.
So as you can see in the image there, you can see how massive the liver is. As Dr. Martinez was saying, is the largest gland in the human body, and it's basically the heaviest internal organ we have, and also the biggest. So it basically covers from all your abdomen from right to left. Of course, it's more located in the right upper quadrant, but it's massive. And of those amazing facts, I would think that the regeneration is pretty amazing. We can name thousands of facts because it's such an important organ that it does a lot of different jobs. But knowing that it can regenerate is very useful, because that is why it is very easy to transplant this organ without having to lose your liver. So it is very amazing. I think it's amazing. Part of the liver diseases that we're going to talk about are going to be, or they're going to be different, but the first are going to be the hepatitis. Basically, the term hepatitis means inflammation of the liver. So many different conditions can cause inflammation of the liver. Basically, when we talk about hepatitis, most of the time we're going to be talking about viral hepatitis, which means that the inflammation is caused by a viral infection. So of course, a lot of us have heard about viral hepatitis. We have heard that they're named with letters. So we have hepatitis A, hepatitis B, hepatitis E, and even some others that are not so common, but we have hepatitis epsilon and all others, including D. Here in the picture, you can see right in the left, like a normal healthy liver, and then when it's inflamed, so you can see it's swollen and the color is a little bit different. So basically, with Hep A, it's not that common in the United States anymore. There are still some cases, but it's not that common. About 2,500 new cases a year, and I guess it's important because there's a vaccine to prevent it. And that's one of the reasons why it's not so common in developed countries, let's say. Hep B, on the other hand, it is more common, a lot more common, about 19,000 new cases each year. But it is very important to know that it's also preventable because we have also a vaccine for Hep B. And it's important because different from Hep A that causes very mild symptoms and usually people recover very well. In the case of Hep B, there's a percentage of patients that will develop chronic liver disease and might lead to cancer. And this is something that also happens with Hep C, which is even more common than the other ones. We have more than 30,000 new cases a year, and of course, they can also lead to cancer. But unfortunately for Hep C, we don't have any vaccine. So we still have to prevent it some other way, so we have to learn how we get it. What are the symptoms of having hepatitis in general? There are all symptoms that can be present no matter what type of hepatitis do you have. Jaundice is one of the most common, which is the yellow coloration of the skin, sometimes the sclera, which is the white part of the eye. It can be present in the hands. Of course, we have to know that a lot of people have a little yellowish tone in their hands, but not in the rest of the body. That doesn't necessarily mean it comes from the liver. Jaundice is present in multiple parts of the body. So if you have a yellow tone in the palm of your hands, probably it might be because you're eating carotenes, which are present in red colored fruits and vegetables. So it might not be related. That's something that I wanted to clarify. Another symptom, of course, is fever. Since they are caused by viruses, when the body tries to get rid of these viruses, it rises the temperature trying to kill them. So fever is very, very common. Of course, some right upper quadrant pain is also present. It's not always very severe. Actually, most of the times it's pretty mild, and with Hep C and B might not even be present. Nausea and vomiting is also very common, especially for Hep A, but it can be present in Hep B and Hep C also. This is something that we call coluria as a medical term. That means the dark coloration of the urine. So people will start peeing like in a dark color, like you see here. On the left, you see the normal color of the urine. On the right, you see coluria. Because bilirubins, which are a pigment that is, let's say, metabolized in the liver, it cannot be metabolized properly, so it passes to the urine, creating this coloration. And the stool, the lack of color in the stool, either a little grayish or white, is also a symptom of hepatitis, because the pigments are not going to the stool, but they are going somewhere else because they're not able to pass in the right way. So this is one of the main symptoms that we have in all hepatitis, especially in Hep A. What are the risk factors? Of course, in this case, they will be very different depending on what kind of hepatitis we have. In case of Hep A, we have to learn that number one risk factor is eating in places where the food handling is not the best, because it belongs to a type of infectious disease that we call fecal oral. That means it is transmitted because the virus is present on the stool, and then you have to put it in your mouth. And I know that sounds kind of disgusting, but that's how it is. Doesn't have to be a big amount, but just having it after going to the bathroom, then that's it. You're gonna transmit it to someone else. So that's number one risk factor. And I guess now with laws and campaigns about washing your hands and using gloves and of course the laws being very, very good about food handling, that's why in America it's not very common. But some other places, Asian countries and some South American countries, this is very, very common. So in a certain way, it is classified as kind of food poisoning. Hep B, but in the other side, is very, very different from Hep A. It's also a virus, but and the symptoms are similar, but that's the only thing they're similar. Hep B is a bloodborne pathogen, which means the risk factors are, for example, IV drug users. If they share needles, they're gonna share blood. They're gonna get blood from someone else, so that's gonna be a risk factor. Also, if you have a sexually transmitted disease, if you have one, you have high risk of having another one. So if you were ever diagnosed with one, no matter what did you have, you should be tested for Hep B. People that undergo dialysis, hemodialysis, which is the dialysis that's done in the blood, they're also at high risk, especially if they've done it for some decades. And multiple sex partners. Of course, Hep B is considered a sexually transmitted disease, not exclusively, and that's very important. Not everyone that has Hep B had to got it from this way, but it is considered in a certain way. And of course, health professionals are at a very high risk. That's why in the United States and most developed countries, it is required for healthcare workers to have the vaccine, or at least the titers, which means that they had the vaccine previously and they still have immunity against Hep B. So for you to work in the United States in the healthcare industry, you have to have the vaccine. In the case of Hep C, they share a lot of risk factors with Hep B. Hep C might also be sexually transmitted, but it's not that common, because Hep B can be transmitted by exchange of blood and some other fluids. In the case of Hep C, it's mostly by blood. So we have some risk factors, and probably you've seen it because in the United States, there are campaigns to try to diagnose these people. So if you you were born between 1945 and 1965, which is like the baby boomers, they are an increased risk because blood banks didn't test for Hep C in that time. And of course, there was a boom also in the Hep C in that time, so everybody should get tested. Also, if you received blood transfusion before 92, that's also a reason why you should get tested. That are risk factors together with the ones that I mentioned with Hep B. How do we treat them? There are certain common things that we do. Of course, when we're talking about both A, B, and C, I mean, we're talking about the liver, so of course you should stop drinking. That is number one. I mean, maybe not forever, but at least for that time, especially for Hep A, that it's pretty mild and usually you have a very good recovery. You can stop for at least for that while, which is going to be probably about 4 weeks or a little bit more until your liver function is okay. Then you can restart again, obviously at a controlled way. With Hep B and C, I wouldn't recommend drinking at all because they are chronic conditions. So as long as you have them, it's not very recommendable for you to drink. With Hep A, um, try not to take Tylenol. And I guess this is one of the very few conditions in which actually doctors are gonna tell you not to take Tylenol, because Tylenol is metabolized in the liver. So of course, if you have inflammation and you have some infection there and things are not working properly, then you might end up causing a little more damage than good. And also, if you have Hep A, you should, in a certain way, be like you shouldn't share plates or cutlery or anything like that with your family members, because like I was telling you, this is easily contagious. So you have to have your own for that period of time. It's not that you have to be on a room by yourself, not, but at least not sharing glasses or plates or forks or anything like that until you are cured. With Hep B and C, we have similar treatments because they are more similar one to the other. Of course, that would be pills. We have antivirals right now, which are very, they are effective against Hep B and Hep C. And if unfortunately it got that bad that it needed, that it became cirrhosis, then people might end up needing liver transplant.
Okay, now we have another important condition of the liver, and it is called the cirrhosis. We bring cirrhosis here to the presentation because one of the risk factors for having cirrhosis are hepatitis, as Dr. Mesa said, and the chronic ones. So the B and the C will be, as we will see later, one of the most important risk factors for having cirrhosis. Cirrhosis is the 12th leading cause of death known in USA. It has a mortality rate of 9.7 person per 100,000 persons. Cirrhosis is the result of accumulated liver damage, a chronic liver damage. So it, as scar tissue replaces the normal one as a result of accumulated liver damage. It happens after the healthy cells are damaged over a long period. The scar formed by the cirrhosis deserts, as you can see in the picture, the liver architecture and forming multiple nodules and in the shape. By basically blocking the blood flow to the liver, impairing its normal function. As I was telling you before, the main risk factors of having cirrhosis are hepatitis, the chronic ones, so B and C. The misuse of alcohol, we call the misuse of alcohol, drinking 50 units of alcohol per week if you're a man, or 35 units of alcohol per week if you're a woman. Obesity is another risk factor, and another pathology or disease that is called non-alcoholic fatty liver disease. That is just the accumulation of fat tissue in the hepatic tissue that is not allowed to the alcohol use. Some of the main symptoms, they are quite similar to the hepatitis. Typically, the disease develops slow over months or even years. So early, it doesn't have often so symptoms. As the disease gets worsens, it can become, people can become tired, weak. They also have jaundice or yellow skin, as Dr. Mesa said. They start having fluid build up in the abdomen. We call it ascites in the medical term. And also because in the hepatic tissue, we have some hormone metabolism. We can find in men breast enlargement, so that it is an important symptom also.
Yes. I guess it is a condition that we hear a lot, and we see a lot in our patients. Unfortunately, it used to be more because of alcohol, and I say unfortunately because of course that's very preventable. But now it's it's being more common to be caused by those conditions like Hep B and C. So it's something that we see all the time and that we wish we could see less, but prevention, like always, is the best tool in this case.
In the diagnosis of fibrosis, the gold standard and the main one will be the liver biopsy. But there is a small but significant risk for doing this. So if you have the typical laboratory findings and the typical findings in images, as we can see in the picture, this is a tomography, it will be not necessary to do the biopsy. In the laboratory findings that mainly we can find, low platelets and abnormal liver function will be the principal. About monitoring some patients, we have to monitor two kinds of patients: the patients without cirrhosis, but that have some risk factors that we have told you. You have to see those patients each 2 years, and patients with cirrhosis each 6 months, because you have an increased risk for having hepatic cancer. In the treatment of cirrhosis, as Dr. Mesa said, in all hepatic diseases, it is recommended for avoiding alcohol consumption. In this disease, it will be necessary to stop all alcohol drinking. Of course, you have to focus on healthy eating habits, and when it will be necessary, in almost all cases, to get to the liver transplant. Okay, and the last one, and I think the most important, because it is the most dangerous, is the hepatic cancer. Liver cancer is the 6th cancer in the world, so it is quite common, and the 3rd cause of cancer-related death in USA nowadays. The leading cause of liver disease is cirrhosis, due to, as I've told you, hepatitis B and C. So we want to figure out the relationship between those 3 pathologies, and as you can see in the picture. I'll let you know that it is quite important. So you have to treat the first and the second one properly. So if you don't do that, you will lead you to hepatic cancer. The diagnosis of hepatic cancer are mainly to know the risk factors. People with symptoms, as we have told you before, jaundice, ascites, yeah, the main one. To do some images like tomography for looking how is the structure of our hepatic. We have the treatment, just like 2 treatments. One of those is liver resection, and the other one is liver transplant. Not always you will need the liver transplant when you have hepatic cancer. Liver transplantation is just for patients that are not suitable for the resection. When patients have a sufficient hepatic function and they just have a solitary tumor, they can have the liver resection as a treatment.
Okay, I hope you like the presentation. There's something like a little summary that I would like to say. Of course, the liver being so big, so important, has many different conditions that can affect it. We try to mention the most common, and we try to mention them like in a little story, like what leads to what if you have it. So of course, inflammation leads to cirrhosis, and cirrhosis leads to cancer. Cancer can happen without having cirrhosis, because there's many different types of cancer in the liver, not only hepatocellular carcinoma, which is in this case the one that's related with cirrhosis, but definitely it is the most common, and unfortunately we see it too often. So if you think you might have any of those symptoms, your skin coloration is turning a little yellow, you see that your abdomen, like you're starting to feel like you're fat, but it's not really fat, but it's more like liquid, and you cannot explain it, or you're gaining a lot of weight recently without any explanation, those might be symptoms of you having some liver condition. So would be good for you to go to your doctor and get tested to see what's going on. So now let's hear your questions, please. We both enjoy this very much.
Dr. Mesa,
Yes.
If you have cirrhosis of the liver, can you also have a transplant for that, or that's not recommended at all?
Cirrhosis is a chronic condition, and it can be caused by different conditions themselves, different infections sometimes, or different inflammations. But ultimately, it will end up in total liver failure. So at a certain point, it's reversible, but if you cross certain line, then it won't be, and you will eventually end up needing a transplant. So not everybody with cirrhosis needs it, but definitely some that when the liver function is very impaired, when it's very bad, they will need it. So it might be a solution, but of course, you have to get to a certain place in which it is irreversible. Because as I said, and it's very amazing, liver can heal itself very, very good till a certain point. So of course, it will be the last resource, but unfortunately, some patients will end up needing it. Of course, being alcoholic cirrhosis so relatively common, that makes us consider transplant or not consider transplant, especially if the patient is actively an alcoholic, because they will end up doing the same to the new organ. So of course, that is sometimes like something that we have to take into account. But if the patient is recovering and is recovered, or has cirrhosis for some other reason, and it's in that point, yes, transplant will be a very good alternative and safe.
Okay, thank you. I have another question.
Yes.
Is yellowing of the eyes, that's always related to your liver? You have a problem with your liver?
If you only have your eyes that are coloring a little yellow, that's your question? Not always. It's common for other reasons, like the one I was saying before. Eating a lot of carotenes, which are in carrots, for example, in the skin of the orange, in beets and things like that. It can turn your sclera, which is the white part of the eye, a little yellow. Also, it is very common to have it when you have a lot of exposure to the sun. That can also be a very good reason why you have it. But let's see what Dr. Martinez, because she has a lot of experience with eyes, so I think she can give us a better explanation or an answer.
Yes, Lorna. It is not usually that if you're brown, some people with black eyes, they usually have to have yellow eyes. Also, as Dr. Mesa said, the exposure of the sun without any protection, with some glasses with UV protection, yes, they can lead you to have yellow eyes. But yes, if you have an intense yellow color, yes, you will have to get to your doctor to have some tests. Yes.
So Dr. Martinez, so race is part of it. So you say African Americans are more prone to have yellow eyes than Caucasians or Latin Americans?
Yes, absolutely. African Americans usually have more incidence of yellow eyes than white people does. Yes.
Oh, okay.
Thank you.
Dr. Mesa.
Yes.
The treatment for hepatitis A, besides drinking, is there something else that you can use that's done for that? Is there medication?
No, there's no medication. It's very self-limiting, which basically tells us that it will go away by itself. The immune system will get rid of it. It's very, 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 very rare for Hep A to evolve into something else. there is a condition that is called fulminant hepatitis, which is common, or not common, but it's more common with Hep B and C. And there are some cases related to Hep A, but usually I would say 99% of times it is self-limiting. I remember, and especially it depends on where you are from. In my country, like people do certain things because they have been told that this helps. For example, they start a diet of sweets. That's what they do. But it is not something that has real scientific backup for this. But there's still people that recommend it, and some doctors from back those days that still recommend it. So they will tell you, okay, you go to a room and do not share your plates and your glass with anyone else, but start eating only sweets. So a lot of honey, a lot of everything that contains a lot of sugar, because the part of the function of the liver is to store that excess of sugar. When we don't eat and when we fast, all the energy that we're going to use for the first 24 hours is stored in the liver. So I guess the theory was that if you eat more sweets, then in a certain way you're going to help the liver to regenerate or to cure. But we don't have any backup for that. You just have to go, let time pass. Of course, you have to rest. Don't put extra weight on your liver. Do not have that many medications, and it will just solve by itself.
So the symptoms will just go away.
Yes, of course. The fever will be the first that will go away. Then the skin coloration will gradually go back to normal. And the last thing that will go back to normal will be the labs, because the liver enzymes are the last that will go back to normal. But eventually, after probably 3 more months, they will go back to normal. So you will be as good as new. It can take a little longer than that, but usually that's the time that it takes.
Okay, thank you.
You're welcome.
So for hepatitis A, I saw that you noted that it's not necessarily very common in America with regard to how food is prepared, because you said it was like that it could be it could go from like the feces, and into the mouth, however that worked. So before going to maybe a country that doesn't have laws like the US has to regulate that sort of thing, is there anything you should do before, during, or after your trip to kind of maybe avoid or deter you from getting hepatitis A?
Yeah.
Yes.
Yes,
The main thing with HEP and with Hep A mainly is to prevent risk factors. And as Dr. Mercer says, it is a fecal oral disease. So the main thing is to wash your hands, to go to restaurants, a clean one, just not going to a dirty place. So it will be the mainly preventions you can take for going to those countries for not getting the disease.
Of course, as I mentioned, we have a vaccine for Hep A, and now it's widely used, widely recommended. It usually, we start vaccinating children at age 1 in the States and in many other countries. But of course, population that was born probably before the 80s, they don't necessarily have the vaccine. So of course, if you're planning to go to a place where Hep A is more endemic and they have a lot of cases, getting the vaccine would be wise to do. Of course, sometimes it's impossible to know what restaurant is handling their food correctly, but of course, try to avoid things that are very obvious, like eating in the street or things like that. Try to eat from big food chains, and it's not that I want to sponsor any chain or anything, but of course, wherever you see and you can actually see how they prepare and handle the food, that would be the best, because there's nothing else you could do. The only thing is getting the vaccine and then just trying to eat in the best places you can.
Question, sir.
Yes.
First of all, how much is a unit of alcohol?
I knew somebody was going to ask me that. It depends. It depends. I didn't put the picture, but it depends on what beverage you are choosing. So it's different. Usually it's about a glass of wine. That would be the 1 unit. But of course, transferring a glass of wine or translate it to a beer, it's a little difficult. So that's like the standard measure for somebody like that. But of course, it's very different. Would be, I think it's the equivalent of a glass of wine would be a shot of whiskey, if I'm not wrong. I don't have the exact answer, but of course, that is something that changes or differs between the alcoholic beverage that you are taking. If you Google it, a unit of alcohol, you'll see how it transferred to wine or whiskey or vodka or all that. But it's a great question because, of course, and that's exactly the reason why we put it in units, because it's the way to standardize no matter what kind of alcohol you're taking. But it's not as easy to say, because I don't even remember it. I have to look it up all the time when I'm gonna evaluate the alcohol consumption.
Okay.
Yes, but
Okay,
sorry,
go
in
ahead.
the source I searched for this information. Yes, they took a glass of wine, like 1 unit. So they say that 50 units, so 50 glasses of wine per week. If you're a man, it will be a risk factor. And if you're a woman, 35 glasses of wine per week, it will be another risk factor. Yes.
50 units. You'll be walking on your knees all day.
Yeah,
But it's per week, no? So it should be like 10 per day, not too much.
Okay. One other question, sir.
Yes.
Can hepatitis be transmitted via saliva?
Hep B?
Whichever.
Not really.
Yeah.
But I guess this is the kind of question I would answer yes and no, but we have to be very careful in the explanation because I don't want to mislead or give the wrong answer. Saliva itself would be no. If you analyze pure saliva, you're not going to find Hep B virus there. But of course, we have to take into account that in your mouth, saliva gets mixed with some other things, and blood is one of them. Gingivitis, which is the inflammation of the gums, will produce some bleeding when you brush your teeth. And sometimes it's so little that you don't even notice it, but then you're gonna have blood mixed with saliva. So Hep B and Hep C are transmitted by the contact of blood. I mean, Hep B by some other fluids, but blood also. So if you have any injury on your mouth and you are mixing and you're receiving saliva from someone else, from I don't know, a kiss, probably that's the most common. If they have an injury also, then it might be a risk. How big is the risk? Not very high. I mean, it's probably something below 1%, I will say, but there is still risk. Of course, it depends on how big the open wound is and how much blood is there in that saliva. So that's why my answer was yes and no. I think you get it, right?
Right, I get it. And
It was a very good question.
My last question. That condition in newborns known as bilirubin, is that related to the liver, and how does that actually occur?
No, it is not directly related to the liver function. It depends. There is an early stage and a chronic stage. Instead, the early stage is the dangerous one, and the later stage that begins between the 2nd to the 10th day of birth is quite normal. It's just because the liver of the newborn are not too mature to metabolize those products. But the one that starts at the first hour or the first day of living, this is the one that we have to look about diseases. Sometimes mother with type of blood O and the newborn with type of blood A, they have some reaction, and they start clothing the red blood cells, so they start getting yellow. So this is important. But the first yellow that they in the first day that appear, so it is important one. Yes.
Okay, thank you.
So basically, bilirubins, the first question what are bilirubins? So it's a pigment. Bilirubin is actually a pigment that is present first in the as hemoglobin. Hemoglobin is a protein that carries oxygen, and it's present itself in the white blood cell. So when white blood cells die every, let's say, 120 days, because that's the mean life, the hemoglobin travels freely through the bloodstream, and it goes to the liver, and the liver tries to recycle as much as they can to create new red blood cells and new hemoglobin. But hemoglobin gets metabolized to a similar, hemoglobin is red, that's why red blood cells are red. So when it gets metabolized, it becomes bilirubin, which is basically like yellowish or green. So when newborns, all the newborns, if you do blood work, they will all have the bilirubins at a very high level. Well, not a very high level, but more than normal, let's say, for an adult. Because as Dr. Martinez was saying, the liver is immature and it cannot process the pigments so fast. But this is normal. If because of the bilirubin accumulation, they will get jaundice, it will usually appear later. But if this jaundice appears very, very early, like in the first 2 days or 3 days, then we have to measure those levels to see if they go beyond a certain threshold. Because it might indicate that the red blood cells are dying faster than usual. Not the 120 days is normal, but they are exploding, let's say that, right now. And that happens, that's called hemolysis, when the red blood cells explode, let's say that. That happens sometimes when the blood type of the mother and the child is not compatible. So for example, O type with A. So the immune system of the mother attacks the blood cells of the child and explodes the red blood cells. So of course the liver will process that hemoglobin and will turn it into bilirubin, and then that's what happens. So it's normal, but then to a certain point. So we always have to be careful trying to see which child has a normal physiologic jaundice and the one that doesn't. I guess that's a little explanation of that.
Great, thank you.
You're welcome.
Hello. So you said cirrhosis of the liver was caused by inflammation over time. So does that mean that younger people are precluded from having cirrhosis, or even hepatic cancer? Is there like an age threshold that that is more susceptible to it?
There should be. If you think with that logic, like it requires inflammation and time, then of course it's very logic to think that probably the older you are, the higher the risk. And yes, but then we have to take into account the other factors. For example, what is causing the inflammation and when did it start? Because, for example, if you get Hep B when you are born, because that's possible, then of course you're going to get it very young. But if you get Hep B or Hep C when you are 40, probably you will end up having cirrhosis when you are 50 or 60. So it also depends on what type of inflammation and when did you get it. So you will see that if we made like a little curve or a graph to see like the ages we have cirrhosis, it will show like peaks in different ages because of the different reasons. Probably alcohol will show a little later, at least after 18, because it's more common. But of course, now we start seeing people drinking younger and younger, so that peak will show before that. If we see because of Hep B and C, well, of course, it's going to be more after the time you start having sex. But then we have another type, which is the babies that acquired it in birth, both Hep B and C, mostly Hep B. So because of time and inflammation, it should be older people. But since there are very different conditions that cause this inflammation, we don't have a specific age for like a risk factor.
Okay, and are the treatment options for children or young adults different than those for older people?
No,
Yeah.
it should be the same. We have just the two that I have mentioned. It depends also, as Dr. Mesa said, the mainly cause of the disease, and it depends when you have symptoms of cirrhosis. It means that it is on a later stage. So if you have a children that already has symptoms, it means that it has a very advanced disease. So he would need or liver transplant. That is the main treatment. But if you're a young adult that you just have a little jaundice and your symptoms are not quite big, so maybe if it is the cause, the mainly cause is hepatitis C or B, it will be treatable with vaccines and some healthy conditions. So it depends on the stage that you have of the disease. Yes.
When Dr. Martinez said no, I was going to say yes, but basically it was going to be the same answer. It's not that we have different treatments, but definitely the order of how we treat them will change depending on how young you have it. So antivirals, for example, were not approved first in children. Now they're starting to be, but that is not the ideal patient to receive antivirals. We can do it, but in children, you'll see that transplant is more used. It's like the preferred treatment for cirrhosis. It will be the transplant. Of course, we can use some of the treatments that we use for adults and children, but you will see that transplant is very, very common. So the answer is yes, we have the same, but we try to use some more in adults than in children, for example, because antivirals have a lot of adverse reactions and secondary effects. So they're not as good. They're not tolerated as good for children than by adults. So transplant, you're going to see that it's more used in children.
Thank you.
You're welcome.
Dr. Mesa, I have one more question. When you do your annual physical and you do blood work, are your liver enzymes tested at the same time, or is that something that your doctor would have to ask for specifically?
Yes. When we do a yearly physical, they are going to do several things, but one of the things they're going to do is a comprehensive metabolic panel. The comprehensive metabolic panel has blood sugar, has kidney function, and has liver function. Of course, it's not going to be the whole panel, but it's going to be very good. They're going to measure bilirubins, they're going to measure and liver enzymes, basically, because there are some other things that we can measure, but of course, this first labs will lead us to what to order next. So a basic and a screening test will be in your regular physicals lab work. Yes.
Thank you.
You're welcome.
Did you say that there's a relationship between cirrhosis and liver cancer? And if so, what is the relationship?
So almost, I will say that even the half of patients that have cirrhosis, it means that the liver start getting like a big scar. So it changed all the structure of liver function. And yes, almost a half of patients with cirrhosis will get to hepatic cancer if they don't get treated well and promptly. Yes, it has a really high relationship.
Yes. Of course, we are talking about hepatocarcinoma because we're talking about the cells that make up like the liver, most of the liver. Because of course we have the ducts that are the liver ducts that are made from other cells. So we're not talking about that. But hepatocellular carcinoma, which is when the cells of the liver begin to reproduce uncontrolled, that's because they have withstand like a lot of inflammation and healing, and then they scar. So when they scar, some of these cells will not be like normal liver cells, but they will become more like as a fibrous tissue, and some very few will end up becoming cancer. So like Dr. Martinez said, almost half of patients with cirrhosis will end up having cancer. And I think it's even more if you don't treat the cause. So if you have cirrhosis for a certain period of time, it will almost always end up in cancer, because healing and injuring cells, eventually in such a big organ will end up triggering cancer somewhere in some way.
Next question is, how much of the liver do we actually need? How much can we transplant?
Well, we actually, as Dr. Martinez said on her presentation, on one of her slides, that we have 8 different lobules of the liver, but anatomically, like grossly, we divide it in 2 lobules, the right and the left. The left being very small compared to the right. That's usually the only thing we need, and it's less than 45% of the whole organ. So basically, with that little portion that we transplant, you're going to be able to regenerate an entire organ from that. So that would be the answer.
How long does it take, or how long can a person have hepatitis C and not realize it?
Unfortunately, very long. Very, very, very long. It can be 4, 5, 10 years without knowing it. Of course, once you get the diagnosis, you're going to end up realizing that you did have some symptoms, but you just ignore it because they're not necessarily very, very like severe. Of course, this changes one patient from the other. There are some patients that in a couple of years will develop a lot of symptoms, but it can be very gradual. So of course, you're going to see, oh yes, that's why my abdomen was so big, or this is because my urine back in 99 was so dark. So it can be decades, but it can also be a few years, but it can be a long time. That's why we recommend people to get tested even when they don't have symptoms. Even if you have only risk factors, then get tested, because we will be able to get it diagnosed sooner. And Hep C can be cured if treated properly, and this is something that people should know. Hep B right now it's not in that. Probably in the future we'll be able to cure it. So Hep A cures by itself, and Hep C, if treated appropriately and soon enough, can be cured. So that's very, very important.
Can a woman who has hepatitis C have a baby?
She can. The risk of Hep C going to the baby is not that as high as Hep B. but she can, and especially if she is taking medications, because Hep C is present on the body, but not necessarily causing damage. When it's chronic, sometimes you don't even see it. You have it, but it's not causing symptoms. So it might not be very easily transmitted. That's why actually Hep C is not a common test for pregnant women, but Hep B is. So it can, but in birth itself, if the baby has any injury on the birth canal and blood mixes, then that can happen. But transmitted directly, not that easy.
What about if the father has hepatitis C?
No, that the answer is no. The mother can have it, but not the baby necessarily. It's nothing, no connection between that.
Yes, because it's necessary. You have to have it on your bloodstream to pass it to the baby. So the man wouldn't have anything to do there. No.
Thank you, doctors.
Okay, thank you all for your attention and for your questions. They were very, very good. Hopefully you liked it, and you're gonna be here for our next webinar next Thursday. Again, thanks Brightbud.com. Thanks Dr. Martinez for her point of view, which is very helpful. And see you next week.
Thank you. Good night.